the producer. Let me return to the studio and begin our discussion, which is the Kickstarter celebrating World Field Epidemiology Day. There's a lot that we shall be chewing on with regard to epidemiology. I'll be introducing my guests who will be helping us on that. But before I do, let me just give you a preamble. The past years have brought unprecedented visibility to the work of field epidemiologists as the world fought COVID-19. But this visibility did not result in understanding of the importance of the field, and the need for increased support went unnoticed. On this date, 7th of September 1854, a gentleman called John Snow took his findings from his now famous investigation of the Broad Street cholera outbreak to local officials, leading them to take action and, as it's reported, remove the handle of the offending water pump, and henceforth the day has been added to the calendar and celebrated thus. With me in the studio, I have Dr. Herbert Kazoora, a senior epidemiologist at the African Field Epidemiology Network, AFINET, to help us understand a lot more about that. I'm also joined by Ayub Kakaire Kirunda, the senior communications officer at AFINET. Gentlemen, welcome to the program.
Thank you.
World Field Epidemiology Day. That is today. What is epidemiology? Dr. Kazoora.
Thank you so much, Chris, and good morning, viewers. Field epidemiology is a subdomain of public health that really looks at the distribution, the determinants of health-related events or diseases within the population. Okay. So you're looking at the distribution and the determinants. Where are the diseases? Which communities are affected? Who is affected? And when are they affected? So that deals with the distribution. And then the determinants looks at the risk factors. Why are these people affected? Are they exposed to a certain disease-causing organism? Are they exposed because of their occupation? Are they exposed because of travel history? Are they coming down with the disease because they've not been vaccinated? So those are the determinants of disease. And the using of this knowledge to control and prevent diseases in populations. So that's epidemiology in general, but the addition of the word field denotes that this application of knowledge about determinants and distribution of disease is done in a field setting, in a population that is at risk, in a population that is affected. You know, compared to the clinical epidemiology, because there are several subdomains of epidemiology. You could even talk of a desk epidemiologist, someone who does all this distribution and determinants of disease within an office setting. And so clinical epidemiology is the application of this science in a clinical setting within a hospital facility, looking at the characteristics of the patients that are coming in that hospital, looking at their distribution, their age, their sex, but also looking at the effectiveness of treatment that are administered to these patients.
Okay. So what I basically understand with that explanation, my layman framework of thought, is when you look at the country right now and you were to offer what can be an epidemiology map, where are we having the most pain points? Which areas of Uganda do you consider to be affected most by a certain disease, and there are particular determinants that you've identified as causing these particular diseases and how they can be dealt with?
Okay. Thank you so much, Chris. So in terms of distribution of disease, we have diseases that are widely distributed, that you have much of the population in the country at risk of getting disease. For example, malaria, TB. TB, not necessarily, but HIV, everyone is at risk of getting HIV. But we've also heard of hotspots where when they do the HIV indicator surveys, you'll find that a certain district has more HIV than another in terms of prevalence, in terms of numbers compared to the national average. So we have those hotspots that we can focus on and then direct interventions to. So we have diseases that where populations that are, for example, in fishing communities, where you likely to have poor sanitation in some of those populations, and so you have a high risk of diarrheal diseases, cholera, dysentery, in such subpopulations. So having that awareness of the risk factor about diarrheal diseases, you then target interventions to those subpopulations and you try to interrupt the transmission of the disease-causing organism.
Okay, I'll be returning to you shortly for some of those interventions and how effective the process is when it comes to those areas of the country that are widely affected by diseases. Now, with regard to the World Field Epidemiology Day, which essentially is today, I would like to take this question to Ayub Kakaire Kirunda, who is the communications officer. Increasing diversity, equity and inclusion in field epidemiology has been chosen as the theme, especially as we look at the day in light of what John Snow did way back before some of us would even. Just take us through the theme, the significance, and why you arrived at it.
Yes, thank you, Chris, for that question. I'll start with an analogy, maybe.
Okay.
It's like being invited to a party. That's diversity. You invite everyone.
Yeah.
Then inclusion, taking part in the dance.
I like
then
that.
equity is being part of the planning, like you involved in the selection of the music you're going to dance to. So that kind of inclusion. So I'm taking it back to field epidemiology. Why that theme? There are so many players. Right from, you can look at it in very many angles. Right from training, you are looking at different cadres. You see, public health is not purely medical. There are other players, key stakeholders involved in public health, including you, the media, you have teachers, you have community health workers, even sometimes taxi drivers. They can offer some help during like outbreaks, like you saw during COVID, security forces. So that diversity, the including like everyone in this is very critical. So the global task force for global health saw that as an important thing. And together, the different networks in the different continents, AFINET, there's one in Asia, one in North America, and then the global and TEFINET. We sat together and thought that we need to be more inclusive in this. And even field epidemiology training programs, which we represent here, are diversifying in what they are doing in terms of epidemiology and bringing on everyone, not to leave out anyone. Yeah, so that's why we chose that theme for this year. Go on.
Okay, and where will the events be, and why did you choose that particular location?
Okay, this is a global event. It's universal. Everyone celebrates it. Others celebrate it today, others some days after. But you know, this is the third time we are celebrating this day. It's fairly new, so people are still understanding the concept. We started during the lockdowns of COVID in 2021. It was purely virtual over the world, even as we held it virtually. Last year, there were some opening up. People were doing different activities, popularize field epidemiology in the different countries. Like in AFINET, we're in over 40 countries in Africa, so different programs on the continent were having different activities, some in blood donation activities, some health promotion activities. So some are celebrating today, others will celebrate maybe after today, depending on their schedules.
Okay, so it's going to be virtual?
Yeah.
All right. I thought you were very much in tandem with how government does its things, and perhaps it was on board as a stakeholder, and you have chosen a particular location.
Yes, we work with different governments.
So that you can hammer down the fact that some of these diseases are occurring in particular areas can be given attention. Okay, let me return to Dr. Kazoora and look at the fact that it's field related. Let's leave the clinical.
Yes.
When it comes to field work, especially in the health sector, there are enormous challenges. Many times we've seen health workers talk about the inability to reach communities that are vulnerable. When they do, they don't have the capacity to conduct the much-needed interventions that you talked about. So I want you to help us understand what interventions are in place, and the rate of success is important because it either inspires or calls for new action to bolster the energy levels, especially from actors like you. Yeah.
Thank you so much, Chris. So, looking at the success of most of our interventions, the aim of field epidemiology is really to narrow down on the drivers or the risk factors for a given disease. For example, if you look at COVID-19, we had one of the risk factors was people congregating and coming together in mass gatherings in churches. And you recall the intervention in place was to lock us down so that the transmission rates within the populations can be reduced. So that is one success factor. But then you also look at the vaccine preventable diseases that we've had in the past, the polio. They still exist, but we have very successful interventions. We have vaccines in place that are administered to children, and those vaccines increase their immunity towards these pathogens. The disease-causing organisms are around, but the individual who is at risk has received a vaccine, which is an intervention, and that intervention increases their ability to fight the disease. So vaccination, looking at COVID-19, the social distancing intervention as one success factor. If I look at masking as an intervention, which is informed by public health, which is informed by field epidemiology. If you look at HIV and the successes that we've registered as a country, the ABC intervention, the abstinence, the being faithful, the using of condoms for those that cannot adhere to the ABC, we've seen the success of that, bringing down the prevalence of HIV to as low as 6%, 3%. From 30% when the pandemic was first detected in Uganda. So there are several interventions that have really demonstrated success in the field.
All right, we shall go for a break because it's just reaching the bottom of the hour of 8 o'clock. When we return, this conversation will continue, and we shall be delving into a little bit more detail, especially on the challenges of the scientists who are working under the aegis of epidemiology on how some of these interventions are going on. But I'll also be relating to something very controversial that is covered by the paper today. We shall continue to hammer down that until some things are corrected. Whether epidemiologists can help us understand why this is so remains to be seen. Stay with us. Welcome back. We're glad you're still with us, and we are looking at World Field Epidemiology Day and everything around epidemiology. Before I went for the break, we were talking about aspects of disease intervention mechanisms that are being rolled out and how effective they are in arresting some of these conditions. But before we go into the nitty-gritty, I would like to touch on the aspect of safety and compensation of field workers, and in this particular case, epidemiologists, in case of an outbreak. This has been a bone of contention, especially with regard to how medics intervene and the attitude, so to speak, with which they intervene. If you know that you do not have the gear required to do the work, then you may be cautious in doing this kind of work. If you know that the compensation is not adequate, it could also affect some of the medics and how they intervene, especially when an outbreak has broken. So let me put this question to Ayub Kakaire Kirunda, the communications officer. You speak on behalf of AFINET. I'm sure there are safeguards put in place for the scientists and the medics who go out to the field. But we cannot shy away from the fact that pain points still exist. How is this being addressed within the framework of AFINET?
Thank you so much, Chris, for that question. In AFINET, AFINET has the AFINET Corps of Disease Detectives. Those are people usually who are deployed when there are outbreaks across the continent. So these people are, when they are sent to the field, they are covered by different insurance covers. So at least within that cover, these people can be like catered for in case of any incident, unfortunate incident in the field. But AFINET doesn't work alone. There are other agencies usually that are involved during these outbreaks, including even the Ministry of Health here. So people usually who are sent to the field, government doesn't work alone. They work with partners like AFINET, WHO, UNICEF, and usually they take a lot of effort to make sure that these people who are going to do disease investigations and surveillance are catered for. So at least from the aspect of field epidemiology, some effort has been put in place to take care of these people when they're in the field. My
question came on the background of what happened during the COVID-19 outbreak and during the lockdowns. There was tension, especially when it came to who touches who and who takes care of the disposition of the bodies and stuff like that. It was a challenge, and I do hope, like you say, it's taken care of within the framework of the various stakeholders that you work with. I'll be returning to you a little bit later. I'm looking at the Daily Monitor with a story that shocks the conscience. The National Drug Authority is not only being accused, but has also acknowledged that it looked away as AIDS drugs, those are ARVs, were used to feed animals. Now these animals are consumed by Ugandans. It is feared that those who consume these animals and birds could present with diseases, including cancer. I do not know whether within the framework of AFINET or any other epidemiology network, we can rightly say that there are Ugandans or a set of Ugandans who are presenting with certain diseases as a result of consuming pork that is laced with ARVs and chicken that has been raised on these drugs. It's a controversial topic, no doubt about it, but your perspective is important. Dr. Kazoora.
Yeah, thank you, Chris. Yeah, this is one of the many challenges that we are faced in public health. As you may know, there is what we call the One Health approach. If you look at this problem, it's not only a human health problem. You have human drugs that are being fed to animals. So it's a problem that requires multiple sectors of, to respond to. So you have the public health sector, the Ministry of Health, you have the animal health sector, the Ministry of Agriculture, and you have the population. So it's a challenge that requires, multidisciplinary approaches to address, to engage all the stakeholders. The farmers that are actually feeding these drugs to the animals need to be on the table to be able to address this challenge. But in terms of saying that there are people who are presenting with cancer and we can point to having consumed these drugs, is something that in the domain of field epidemiology that we can pick interest in. We have proven epidemiological methods in trying to narrow down on the actual risk factors, as I mentioned earlier on. So we use evidence to arrive at conclusions, or we use evidence to inform decisions. We cannot just say someone has cancer and they tell us because they ate pork that had been fed on ARVs, we conclude that actually the cancer is because of those ARVs. We need to do studies on those individuals. So we need to get a cohort or a group of cancer patients that are presented, say, at the Cancer Institute, and then look back in time. So do a retrospective study on these groups of patients and look at a range of risk factors that they were exposed to. Consuming these adulterated animal products being one of them. The cancer could be due to alcoholism. The cancer could be due to self-medication on a given drug. It could be due to consuming any hazardous item that caused the injury to the liver and then led to the cancers and all that. So we look at a range of risk factors and then apply statistical measures. We apply what we call measures of association. You look at the risk factor and look at the strength of association between that risk factor and the disease of interest. So if we look at eating pork as one of the risk factors, we then look at the strength of the association. There are statistical measures we use to say the individuals, that the strength between eating pork and having cancer, the association is statistically strong. And then we make those conclusions. And then we compare with the other risk factors. If we find that those who consumed alcohol excessively over years actually have stronger associations between consuming alcohol and coming down with liver cancer, then we conclude that actually the liver cancer we are seeing is not necessarily due to the pork, but because of the strong associations between alcohol consumption and cancer, we then conclude that this is likely due to consuming cancer and not, consuming alcohol and not pork. So there is need to do studies that are among those populations that have been exposed.
Okay, thank you very much. That is very perfectly explained. I would like to end with Mr. Ayub Kakaire. Since this is the third commemoration of the World Field Epidemiology Day, one would be forced to ask the question, what has been achieved in light of the last two commemorations, so to speak?
Thank you so much. I think we have achieved a lot. We've managed to raise the profile of field epidemiologists, the role they play in investigating diseases and surveillance and containing these diseases. So we've been able to showcase some of the work that field epidemiologists do across the continent of Africa.
That's right.
And we've had very many interesting stories here in Uganda done by our field epidemiology trainees in Makerere University and at the Uganda National Institute of Public Health at the Ministry of Health. They do a lot of work in the communities during outbreaks, and they showcase this work. But we have also used this day to advocate for more investment into the field of epidemiology.
Yeah.
So we are calling on governments, partners to put in some more funds into this area of public health.
All right.
Yes.
Ayub Kakaire Kirunda, Communications Officer at the African Field Epidemiology Network. Many thanks for that perspective. Many thanks to you too, Dr. Herbert Kazoora, a senior epidemiologist, of course, also with Affinet. Now, let me go to my man, Ivan K. Walinyolo, who is standing by in Entebbe. There are so many things or issues that are affecting the population there. Vendors have concerns. Yesterday, we do understand